Good morning. It's Friday, May 22nd, so it must be time for another legislative update from your North Carolina Medical Society. And what a busy legislative week it has been. The North Carolina Medical Society hosted its first virtual White Coat Wednesday. So with coronavirus going on and not being allowed to be physically present in the legislative building, we wanted to create a new way for our members to engage with elected officials. So NCMS board member Dr. Holly Biola helped organize a White Coat Wednesday with about 13 UNC preventative medicine residents. And they interacted and engaged and asked questions with 3 different legislators during their virtual White Coat Wednesday. And it went off without a hitch. It was great. It was engaging. It was fun. So I want to encourage any of you who maybe due to travel restrictions or distance may not have done a White Coat Wednesday with us before. Now is a great time to use this virtual format to engage. We can make it short, we can make it long, really tailored to you and your legislator's schedule. So be sure to register in our White Coat Wednesday link to fully utilize this new format. We really enjoyed using this new system that we have, so are really excited to keep up the momentum and keep it going throughout the remainder of session. Now with session this week, it was another busy week and we've had several bills move. I want to point out one to you that we're specifically following, House Bill 1079, sales tax changes. And why I'm pointing this out to you is it makes a really specific change that would require any recorded webinar for continuing education to be required to collect sales tax. So that includes all of your continuing medical education webinars that you may be doing now. Now, if that webinar is live, sales tax would not be required to be collected on that. But that's something we're closely following. We're going to be reaching out to our specialty counterparts on that to see how that would work. And a number of other professional organizations that require any type of continuing education are closely following this and raising some objections as well. So that's something that we're staying on the lookout for. It's set, move through the whole process except for going through the Senate this week, so it's set to be on the calendar for Tuesday, so we'll be closely following that to see if any changes are going to be made on that specific bill. Now with that being said, hundreds of bills were filed this week at the legislature due to some bill filing deadlines, and if you're interested in looking in those more deeply, please check out our legislative blog. Every single bill that touches healthcare is summarized there, including one on Medicaid transformation that was proposed by the Senate, which would allow, set a new deadline for Medicaid transformation to go live by January 1 of 2020, so next year. So we'll be following that bill closely as well. Another in particular that you may be interested in is relating to telemedicine, which would expand the grant program that's already in place with $30 million to expand broadband. So that's another one we'll be closely following. There are hundreds of others that were filed that we are tracking and following as well. So again, be sure to check out the blog for that. Finally, I want to close with, we are still communicating with our congressional delegation. We're sending a letter to them, asking them to support a number of items and provisions that are important to you, including increasing that FMAP money for Medicaid, as well as some more provider relief funding and some other different provisions. So we are in constant communication with our congressional partners as well. That's all we have for you this week. The legislature is going to be gearing back up on Tuesday, taking a break on Monday for this holiday weekend. So we'll expect to see a lot of movement next week. But hope you enjoy your holiday weekend and get some time to rest and relax. And we look forward to talking to you next week.